Well, a new national poll on children's health reveals that many parents struggle to decide whether their child should stay home from school if they don't feel well. According to the University of Michigan CS Mott Children's Hospital poll, 1 in 4 parents say attendance policies are challenging for kids with medical conditions, while 2 in 3 parents say their adolescent or teen worries about how sick days could impact their grades. 1 in 5 parents consider if their child needs a mental health day. And this month, Michigan lawmakers moved bills in Lansing to give students up to 5 mental health days each school year. 7 Action News reporter Faraz Javed hit the streets to see what people think about that idea.
If the bill submitted in the state House and Senate get the nod, then K-12 students across Michigan could get up to 5 mental health days per school year. But is that even enough for kids? And do parents even think it's a cool idea? Well, to tackle all that and more, I'm headed to Waterford and Troy. I spoke to parents Sandra Daw, Emily Rao, and Cynthia Walker at the Waterford Township Public Library.
I hope they get more input from parents, educators, and pediatricians.
I feel like when I was a kid, I was pretty anxious.
I don't see a difference because whether they're sick, we do call the school and just tell the principal that the child's not coming to school that day.
In Troy, I got input from the mom and daughter duo, Katie and Claire Trexler, and the grandma and granddaughter duo, Tammy and Camden Freed.
It makes sense that they could take it and it wouldn't have any consequences or anything affect.
Kids have just as many thoughts. They get depressed, they get overwhelmed, and I think mental health days, 5 a year, I think that it would be good for them.
What about concerns of missing school or, not being able to catch up with schoolwork?
I think that if they're given mental health days, that perhaps it will be easier for them to catch up on their schoolwork.
I see some of the pros that the school really does not have to know why the child is out. The cons I do see is if the children take advantage of it.
Chronic absenteeism is a problem in the school. And I'm just kind of concerned that maybe some of the kids are just taking advantage of it. Oh, I didn't do my homework, I got a test tomorrow, I need a mental health day.
Say before this bill was even proposed, you think kids were having a hard time even sort of suggesting, hey, can I take a day off?
Maybe, especially, it depends on the parent. I think my mom would, if I was really struggling or I was just really going through a rough time, I'm sure she'd be understanding, but I'm sure some people would find it harder to convince their parents, to let them take a day off.
That's what makes your mom cool?
Yeah, exactly.
Look at that.
I think maybe a better use of that bill would be to providing more social work, more services in the school rather than offering mental health days.
Say lawmakers came to you and they asked, Camden, what can we do to make your school life better? What would you say?
Well, at my school, we have a flex day in each class, certain days of the week. Then you have time to have fun in class instead of just doing your schoolwork.
For 7 Action News, I'm Faraz Javed.